So I'm currently working at Dubbo Base Hospital as an intern.
Fantastic. And what are your responsibilities?
Mainly paperwork, and a lot of clerical and ward work as well. So generally, a lot of it will be ward rounds, taking notes on the ward rounds, making sure you have the relevant information for each patient before you begin so that the consultant or the registrar can have a pretty good rundown of what's happened overnight and if there's been any problems. Once that's done, you're assigned your sort of, you come up with your job list, and it could be a lot of organising scans or organising placements, transferring to other hospitals. And often it'll be, procedural work, so lots of taking bloods, putting in cannulas. And during the day, the way that it works at Dubbo is that you have a pager, so you can be contacted at any time by any of the staff members in the hospital. So you'll have reviews that will come up. So you might have a patient who is hypotensive or hypertensive or febrile. So you go and review the patient yourself, take a thorough history, do an examination, order some investigations, and then check in with your team to see if there's anything else they would like to do or be done.
Great. Can you tell me a little bit more about Dubbo Hospital?
So Dubbo is great. Best decision I ever made to come to Dubbo.
Yep.
It's currently under construction, so we have a lot going on here at the moment. But we've got a brand new ED. At the moment, our ICU is pretty quiet due to COVID, so we're kind of like clearing that out, but we will be getting a new area down there as well. We're actually getting a whole oncology cancer centre set up here as well. We'll be having cath labs soon too. But the hospital at the moment is pretty thriving with lots of construction underhand and going on. So it's actually a wonderful environment to work in. Everyone's very friendly. It's quite a big regional hospital, and the catchment area for Dubbo itself is huge. It's sort of like, a third of New South Wales, nearly sort of from up here up, that we take in from all the peripherals. So we have quite a lot of patients coming in and out, transferred in and out.
Great. And as well as the other doctors that you work with, what other health professionals do you interact with?
So I've currently been on my surgical rotation, and I've just moved on to medical, and every day I work with speech pathologists. I work with the physios very closely. The dietitian is like on speed dial for me. Things that I don't know how to, I'm not trained in any of that. So if I've got patients in ICU or on the ward that need nutritional supplementation, I'm not going to try to handle that on my own. So I link in with all the services. I quite like, especially in Dubbo, we link in with the Aboriginal healthcare workers quite a lot, as well as our social worker. One of the interesting roles in allied health that I didn't know existed until I came to hospital was actually our discharge planner. So because our social workers are often under the pump and have a lot to do, and they're dealing with a lot of complex social situations for our patients. So our discharge planner can actually look into all the things that we need peripherally, like our ACAP planning, or what we might need services in the home, or who's going to come in once a week and help with meals, and they can actually do all that for us. And she goes around the hospital and does this huge job of checking in with every patient about what they might need before they go, so that it just makes our discharging so much easier, which was a very cool allied health aspect. But yeah, regular, radiology, call them daily, pathology, pharmacy. We have a pharmacist on the ward who picks up a lot of our little errors, or or just helps us maximize, the patient care so that we have the right drugs being used. And often you'll find that patients will be on drugs in the community that we don't usually have here. So it's always good to check in with our pharmacist in that regard.
So it's a fairly complex environment. Are you okay to keep talking?
Yeah, all good. I can call them back. Yeah, I can call back.
So is there any such thing as a typical day or a typical week at this stage?
There was until 2 weeks ago.
Right.
So, we've had a lot of changes lately, just in sort of anticipation that we may have to change a few things in the way that the structure works in the hospital. But before, so on my first rotation, there was definitely a typical day. I would get in, so my day starts at 7 a.m, but I usually get in around 6:30 so that I can go through the notes, just see what's happened overnight and prep my list to have ready for the ward round. Then you will go on the ward round. Typically your surgical ward round doesn't last as long as the medical one, so maybe 45 minutes for all of your patients to see them. And so you'll go around and you'll take notes as you go and accumulate your jobs, and with your regs and your consultant. And then after that, you sort of break off to do your jobs, and you're in contact with your registrars during the day. If you're lucky, you can go in and scrub into a surgery if you've got some time. Often when you're post-take and have, 40 patients to yourself, you don't really have time to do anything but handle 40 patients on the ward. But I have been able to go in and do a fair bit of like scrubbing in and assisting in surgery, which has been nice. Not that I want to be a surgeon, but it's a nice, nice way to spend your day sometimes. And when that's all finished, it's usually nearly time to go home. So you'll do a paper round and make sure you've done all your jobs or accumulate a few more. And my finish time is 3:30, though I very rarely get out then. But at the moment, I've just switched into Gen Med as sort of a floating position. So I'm between Gen Med cardio and also the COVID team when it comes to that. And so I'm working Monday through Friday, 10-hour days at the moment.
Okay. And you mentioned COVID. Can you just briefly outline some of the changes to date within the hospital in response to that?
It's been a lot of changes. Basically, restructuring the team so that we have separate medical teams that don't come into contact with each other and do, one lot will do 7 days on and then they'll have 7 days off. The next lot will come in, because if we have an accidental exposure without PPE, which can happen, we lose a whole team for 2 weeks that have to be in isolation, even if they test negative, essentially. Or if they test negative, they can come back, but generally it's a 2-week isolation. So sort of in anticipation of that, not that that's happened, but in anticipation of that, we've just sort of separated the teams out to avoid that. And we've sort of switched around the JMOs a bit. So, with COVID at the moment, Hetty's now put out that we don't have to fulfill our core terms basically how we did before. So it was before to, provisionally go through. So at the moment we're on a provisional sort of registration, whereas at the end of the year you become fully registered, but you had to do a certain amount of time in each of the like ED, surgery, medical, etc. But because of the current situation, Hetty's basically said it's okay, you can go through if you're passed off as competent, but it just needs to be in, it can be in whatever sort of area. So, we won't be switching around like we sort of have been, or interns in the past have. It might not be like that. It just depends what's needed and where's needed. So fair few changes and some policy changes about, things to consider about like resus situations and who can go in the room and how many can go in the room and that kind of thing. So there's lots of safety measures and implications sort of in place at the moment, and restrictions on visitors and that kind of thing. Yeah, so there's been a fair few changes, and I'm sure there is a lot more to come. But at the moment, it's sort of chugging along pretty well.
Right, so watch this space, I guess, in terms of what develops.
Yeah. I think that healthcare is really dynamic at the moment, and there's been changes made where red tape was before pretty quickly, where people have wanted to change things in the hospital system in the past where it was really difficult, have all of a sudden opened up all of these doors and avenues, because it's an sort of unprecedented time in healthcare. And in that, it just means that, if this settles down, do we go back, or do we no longer have that red tape? It's interesting, and I think that it'll be interesting to see how we run hospitals sort of, in the next couple of years, and if it changes anything permanently, or it's an interesting time to be a new doctor.
Certainly, you'll be encountering a lot of things that nobody else has encountered for the first time before either.
Yeah, absolutely. It's a big learning curve. And a big learning experience, and it's a bit scary, to be honest, but it's so far, we haven't really been hit regionally as hard as the city hospitals have, so we're sort of a bit more isolated and lucky out here, I guess.
Yeah. Prior to COVID, what are some of the more memorable experiences that you've come across in Dubbo?
Oh gosh, we get everything here. We have diagnoses you wouldn't even think about anywhere else that you would see. But I guess one of the things that's memorable for me is that I am not a surgically inclined person. I did not like surgery during medical school. It was not anything I ever even considered. And after being here, in this first term, I've loved my surgical term. My bosses are fantastic and inclusive, and I've had such a wonderful experience that it's something that I've, started to think about for the future. I've had some pretty intense moments in after, your first after hours by yourself is something you'll never forget. You're the only doctor on 3 wards, and you can call help in, but you can't by yourself for a bit. So even the low level management of things that you're not sort of used to managing is a bit scary. But I've had a few resus situations, met calls where we've, had to fully resus a patient who's been pretty much unconscious. And so had a few of those which were memorable, but they survived. So
yeah.
And
you mentioned some unusual diagnoses in Dubbo. What sort of things have you come across?
I think it's just that you get to see a bit of everything, like we've had a patient who had a motor vehicle accident, then had a duodenal perforation that then led on to some chronic pancreatic inflammation, or things that you wouldn't usually that's not a common thing to sort of happen. And I think we see, sort of, I can't even think off the top of my head. I'm sorry. If I think of anything good, I'll let you know. But there has been a few things that have popped up that I've just sort of been like, oh, okay. Like, where's that come? Very strange. Infectious diseases. I think that's actually an interesting one. Is we consult our infectious disease doctor, who is basically like call in and get advice from daily, and we just see some of the oddest things, especially from farming communities. And coming from a farm myself, it's so interesting to see, like, how did you even get that particular bug in your blood? Like, where did it come from?
Right.
Yeah, lots of those.
And
lots of Q fever actually as well, which is something I don't see very often. So
yeah. And what's some of the rewards of working in a rural community like Dubbo?
Oh, there's so many rewards. I might be a bit biased because I am a country gal myself. So I'm from Crookwell originally, and did my final year in Lithgow. But some of the reasons I chose Dubbo and definitely have sort of impacted along the way is that everyone here is very friendly. And I know that sounds like something that should just be normal, but it's not always. The bosses are very approachable. I have no issues so far of asking my consultants questions. It doesn't seem like, it's not such a hierarchical issue where only the registrar can talk to the consultant and only the JMO can talk to the registrar. It's sort of, if you're on a ward round, if I have questions, I will ask my consultant questions. I find that to be extremely helpful and useful, and especially for clarifying plans as we go along.
Yep.
I think that the community itself is wonderful. There's like weekend markets and people want to hang out, and a lot of people within the hospital are very friendly and want to go to dinner and want to go to drinks. And I've already had a few friends up here, but I've made so many friends in the last month just because it's just so easy. It's an easygoing lifestyle. The rent is unbelievably cheap compared to anywhere else. I've moved into a house. I was by myself in a house for quite a long time, and then just got some roommates, and I've got a dog and a cat, and it's just easy. It's easy, it's cheap, it's lovely. People are friendly. You get to know the community quite well. You can be involved in things. You can be as involved or less involved. So I was sort of going to like specialized gym classes with, before COVID. Had signed up to play hockey before COVID. So had lots of plans to be doing a lot of sport prior to COVID. So at the moment it's just at home exercise, but there's just lots of things you can be involved in here. Some of the interns were doing like a random rowing club that basically only had people of 50 plus age group in it, and then they sort of joined along as late 20-year-olds, and just lots of opportunities for things you wouldn't have even experienced or had time to do in other places. I mean, I guess the commute for me is 4 minutes to work. It's just a much nicer lifestyle, I think.
Yeah. To counterbalance those rewards, what things do you find a bit challenging?
I think it is difficult being fairly far away from your family. So my family live it's about 5 hours really,
Yeah.
and that's sort of the furthest I've lived from them for a while. Even in Sydney, it was only sort of 3.5 hours. And going home can be difficult, especially with your work schedule. So, a lot of the time I'll be working 12 days straight. So the week, then the weekend, and then another week. And you don't really get all of that much time to go and visit people. I think that can be really difficult. There's ways to overcome that, and I still do get plenty of time to see them, prior to COVID. But that can be a bit of a challenge. I think I often hear that people think it's quite isolating rurally. I don't tend to agree with that. In an area like Dubbo, which is a regional hub, I can understand if you were in Brewarrina or further, more rural, that it could definitely be isolating. But I think going to a regional hub as an intern, you are not isolated. You have a wonderful small group of interns that you can interact with, and I find that wonderful and very easy.
Yeah.
I guess challenge-wise, there's resource limits. A lot of the time it's really difficult to get into a GP here. Like, even for me, I haven't been able to get into a GP yet. It's just backlogged, and there's just not enough sort of resources for that. I think mental health services are extremely far and few between in rural and regional Australia. That's one of my biggest passions in life, is looking at that gap and how we deliver good mental health care to our rural communities. And I think it's difficult to be able to get into those kinds of things. Specialist wise, we have quite a lot of specialists fly in, fly out / who are already here, and have their own specialist sort of fields. I think that maybe there's not as many as the city, obviously, so that makes it more difficult for people to have quite specific care, but it sort of is what it is, and people are working on it, and we're trying to increase the amount of access that we get to that. But I think that can be difficult. It can be frustrating as a doctor to see those communication loops sort of break down, and you would hope the continuity of care out of hospital was wonderful, but it isn't always, and that's more about communication between the regional hospital and the peripheral that organises maybe a lot of their outpatient stuff. And it's always a work in progress, but I think that can be kind of the downfall of being in a place that's a bit more regional.
Yeah. And you mentioned you're a rural girl yourself. What other things led you to taking the career path that you've taken?
Oh, what a question. It was a long decision for me. So I'd always sort of wanted to be a vet when I was little, because I'm from a farm and I love animals. And then as I sort of grew up and I was going through high school, I thought, we don't have a lot of GPs in the area that I'm from. It's quite difficult to be able to see GPs. And as I said, I really love that continuity of care. That cradle to grave care is really important to me. And I think I really like the idea of having one or, two GPs or, doctors through your life that you are linked in with. And I always thought, what's a way that I can help in a community? I thought, well, maybe I would do medicine. But at the time, I was the first in my family to graduate high school. So that was, way out of my reach. I was like, I'm not going to get into medicine. So I actually went to Wollongong University and did a science degree, because that's what my best friend did. And I liked science, and that seemed like a good idea. So that was what I did. Partway through that degree, I added an arts degree onto my science degree to do a double, which was majoring in sociology and science and tech studies, which I loved, and was planning to maybe do a PhD in and become a lecturer, but there's no jobs in that. I'd always said that I wanted to do medicine, but I wasn't really confident enough to try, I don't think. And one day my dad just said, just sit the GAMSAT, we'll pay for it. I think it's worthwhile to go and try. So I did. I sat the GAMSAT and I got an interview, and I just thought, it would all be for practice. And then I got in and was terrified. I had to actually go to medical school. But it was a good decision, and I'm really glad that I was really encouraged by my family. I always had such a strong support network there, and one of the reasons that I wanted to go into med was a very important person to me, who is the GP, one of the GPs in our hometown, and he's 84 now, Dr. Valu. And he's such a hard worker, and he works from dawn till dusk and just services a whole community. And, you know, being from a small town, it's quite an aging population who pop in every day. And he works at the hospital, and he just does such an amazing job. And I remember telling him growing up, because he was my GP basically from birth to still is whenever I can get home. I said, oh, I'm thinking about doing medicine. And so every time I would go in, he's like, have you applied yet? Have you applied yet? Have you gotten in yet? So it's been a good journey to be able to tell him that I got in and that I've finished. And
Yeah.
that was sort of like, I've just always been very drawn to health in rural areas. It didn't necessarily need to be medicine. That's just kind of how it worked out.
Mm-hmm. And you spent some time in Lithgow. What was that like?
I loved Lithgow. It was fantastic. So there was only 6 of us there, and it's a GP-run hospital with ruralist specialists, so GPs who have extra qualifications. So a lot are obstetrics and anaesthetics and GP. They're very multi-talented. And it was great. There was only sort of one JMO in the hospital really at any given time. So as a medical student, you had a lot of responsibility. You were doing intern-based roles. You know, you were scrubbed in and you were first assist for every single surgery while you were on the surgical rotation. You know, and a lot of it, there was no sort of super specialised medicine there because it's, you know, a general rural hospital, but the kind of common things that you saw a lot of. You know, you might not have the neurosurgery, but you have the cholecystitis and the cholecystectomies and the, you know, the things that are generally going to present to you as a doctor, you're pretty well confronted with in those places. And Lithgow itself was an interesting town to live in for a year, but also very great, and lots of support there and lots of community support, and got involved and really liked it. It was a beautiful place to live, and I couldn't recommend it more. The procedural skills I gained from Lithgow were phenomenal, you know, whereas some people might do a cannula a day, I was doing, 20, 30, every day for weeks. And I got to intubate patients and I got to do all of the anesthetics, and it was just fantastic.
Terrific. So in Lithgow, what sort of things should a person do in their spare time?
Oh, in Lithgow?
Yeah, then we'll talk about Dubbo.
Lithgow is beautiful. You should go hiking, and there is some really, really good walks to do. And even if you don't want to walk it, you can drive up a lot of them and just look at the view, because obviously the Blue Mountains are fantastic. Yep. If you're there is like $5 schnitty nights at the Commercial, which you must go to. They have really good food specials. There's a couple of really fancy, nice restaurants around, and some of the hotels there are really lovely. But it's also so close to Katoomba, so you have to go to Katoomba for a weekend at least and do a bit of that. Otherwise, it's just a really nice place to just hang out and enjoy life, go to the gym, be part of the community. There's lots of fun rural shows, like the Lithgow show, Bridal show, go to all of those.
And how about Dubbo?
Dubbo is also very awesome. There's actually a lot of good places to eat around here. I think I've probably been to 80% of them. There's an excellent Indian restaurant that I could not recommend even more highly, Restabar. Oh gosh, what else do we do around here? I work a lot. But there is quite a lot to do, and I've joined the gym. There's a really nice swimming pool. It's just really cool to go and have a bit of a swim at. We do there's some very cool bars. There's sort of a hidden bar, a speakeasy bar that I like. They're called The Establishment. It does good cocktails, lots of good wine around, and just sort of, nice places, lots of pub meals, lots of hanging out, doing pub meals. Plenty of places to play sport and get involved in that. There's a lot of that. There is the Dubbo escape room, which is very fun. Have done that. There's no Kmart. That is the downfall of Dubbo. but Orange Kmart does deliver. So just in case you needed to know. Yeah.
Terrific. Now, for those students who are concerned about leaving family and friends, you mentioned that was a bit of a challenge yourself, but you said there are ways to overcome it. What advice would you give to students who are thinking about that?
Yeah, I think you have to think in terms of how long you're going to be doing it for, and the reasons that you're doing it. I am a really big family oriented person, so I have nieces and nephews and little cousins and my siblings, and we're all very, very close, and me and my parents are very close, and so I do find it really difficult to not see them for an extended period of time. I'm resigned to the fact that I just, once a month, if I can, I drive home. I do the 5 hours there and the 5 hours back, or they spend a lot of time being able to come to me as well, that we can visit. So I think it depends how far you go. Lithgow was even closer and easier, but we have a family WhatsApp group and we video chat quite a lot, which is fun when you have children yelling in the background, but it's always a good time. I think it's just like, you take it bit by bit. So I think that being homesick is hard, and it depends if, I haven't lived at home since I was 18. I moved straight out of home and moved to England. So I went as far away as you can for a year. So I think I probably just threw myself in as hard as I could, as fast as I could, about how far I could go. But I think since then, you've just got to make ways to make it work. And if you want to be rural and your family's not rural, just know that it is going to be a little bit difficult, but to just stay in contact and keep visiting, and you'll find friends and you'll find supports. Like, I have great supports here, and if I'm having a bad day, that's who I'll go to, and that's who I'll have a wine with, or a water. I don't endorse drinking wine when you have a bad day. Never.
And so what impact on your career and your skills and your training has going rural had, do you think?
I personally think it's thoroughly improved my skills. I'm probably more of a person that wouldn't be the one in the room to jump forward and be like, I'll do that. So being in a bigger, crowded city hospital would never have been good for me, because I would have done nothing. I would have just hidden in the corner, I think. But since being rural, I'm a lot more confident. I know that I have the skills because I've been told to just do things. The doctor will be like, well, you're the only one here, so you have to put that cannula in, or, go catheterize that person because you're once again the only one here. So you kind of realize you can do things, so you start to do them more and you're more confident in that.
Yeah.
In terms of training, have no idea really. I've always wanted to do obs and gynae. I love women's health, and I think that access to women's health in rural Australia is extremely important. One of the things I've always wanted to do is the clinical forensic collection master, so that I can be able to do sexual assault forensic collection, because we just don't have enough doctors that can do that in rural areas, and women are re-traumatized by having to, travel another 3 hours to get that done. So, but I can't do that for a couple of years. You have to be third year clinical. So in the meantime, I sort of have made a plan here, because there is quite a lot, and everyone's quite accommodating to what you want to do. So if I want to do the rural advanced training and do O&G GP, everyone's really happy to make sure I get the terms that I need here. If I decide that I want to do straight O&G training, I've already been told I can do my SRMO year in obs and gynae if that's what I want. I can do an unaccredited surge year if I want to get more surgical skills, and then I can get on the program and I can actually do most of my O&G training from Dubbo. I have to go metro for a year or so, but not a lot, not as much as you would think. So you'll get quite a lot of exposure, in rural or regional areas anyway.
Yep.
There are specialties, if you're very keen on, that you're not going to get here. You're not going to get neuroscience. You're not going to open up someone's brain if that's what you want to do. You're going to have to do that in Sydney, Melbourne.
Yeah.
But if you want hands-on experience, and getting onto those programs is really difficult anyway. So if you just want to do some experience and get yourself ready, I couldn't think of a better place to do it. And all of the bosses are so happy to have you and to teach. It's such a big teaching experience. We have protected teaching here, so once a week, pages off, phones off, an hour of teaching, which doesn't seem like a lot when you're a medical student and you are learning all the time. And I must admit, the learning curve of internship is extremely high, you learn a lot, but you also lose a lot of that clinical knowledge. I feel like I'm dumber now than I was when I started. I definitely knew more as a medical student last year than I do now, but the actual learning of the, you know, the clinical stuff is pretty good as well.
And for students thinking about going rural, do you have any practical tips on how to prepare physically and mentally for going out?
Oh, physically, no. Just
Practically, sorry.
I was like, oh, go for a run. I don't know.
Sounded a bit Bear Grylls, didn't it? One student mentioned learning how to change a tyre on a Land Cruiser. That's why I asked. He said, have some other skills?
Yeah, learning how to dodge kangaroos. That's a good one. Just drive slow. Don't drive at night. Don't drive at dusk.
Mm-hmm.
But yeah, changing a tire, learn to do that. You should already know how to do that, everyone. That's a life skill. But I think in terms of mentally, just preparing yourself that you're away from home. If you are, you know, some people are actually quite close to home. They're from around here. Preparing yourself that, you know, I think any intern is going to do lots of hours, but, you know, make sure you're compensated for those, or, you know, willing to do them. But it's not crazy. You have spare time. Okay. It's not like you're here all the time, unless it's COVID. I don't know. I really don't think you need to prepare any more for a rural regional term or employment than you do in the city. I think we all are trained really well in medical school. I think that we all put in a lot of effort, and that, you know, essentially it's going to be a different experience. I actually think it's going to be a better experience. Once again, probably biased, but I don't think you have to prepare in any other way for what you'll face here than you'll face anywhere else. You'll learn to be a lot more independent in a regional hospital. You are sort of not left to your own devices. You have support all the time. I could call my consultant and he would pick up now. But I just think that you learn to handle things a bit more on your own.
Terrific. And do you have any last words for students considering going rural?
Oh, do it. Go rural, or absolutely don't even consider it. Just do it. And good luck with the rest of your training, and just know that if I can get through, you can. So
thank you so much for your time, Kirbie. I know you're really busy, and I appreciate everything you shared with us.
Yeah, thanks for having me. It's been really lovely, and yeah, it's nice to be able to do this. So thank you very much. It's a good break from the hospital. Better go do some work.
Terrific. Thank you.
All right. See ya. Bye.
Bye.